What's up, rookies? Welcome to another snippet on what pharmacists do. Today, I have the honor of having with me Dr. Clipper Young. Dr. Young and I go way back. I was a first or second year pharmacy student when you were graduating. You were doing a rotation for one of our professors, and I was just on you all the time with questions. So you were a tutor and a mentor for me, and I am so honored and excited that you decided to, that you said yes to coming on and sharing your pharmacy journey with us. Welcome, Dr. Young. How are you?
Yeah, thank you, Dr. Owapo, for having me here. And it's exciting to share a few things that I know and also my journey with everybody who's interested. So thanks for having me here.
I'm so happy you're here. I'm so happy you're here. I remember one of our conversations way back when I was a student. I think we were in the parking lot somewhere in front of Lander Hall, and you were getting ready to start your fellowship. And you talked to me about also starting a public health degree at UC Berkeley. And I was just so impressed. And I remember thinking, how is this guy going to do all of this at the same time? And I'm just curious to know why did you choose pharmacy? What made you decide to do a fellowship and public health? If you can tie it all together for us and tell us a little bit about yourself.
Yeah, thank you. So obviously you've done some research on me. So you know a lot of my secrets. So for sure. Let's start with the first question. So instead of saying that why pharmacy, maybe it's a bigger picture, why healthcare. So
Okay.
I was born in China. So
Okay.
and I came to the US at the age of 13. So when I was growing up, I grew up with my grandparents. So my grandpa
Mhm.
had diabetes when he was like the 40s, and then he actually died from kidney complications from diabetes. So
Okay.
I remember going to clinic with him
Mhm.
at
Mhm.
least 2 times a day. And then I asked my grandpa, like, why do you need to go to clinic that often? And the
Mhm.
answer was, oh, I need to get insulin so I can eat. Well, me being a 7-year-old, I didn't know too much what diabetes was or what insulin was. I
Mhm.
just knew that this drug called insulin helped my grandpa to stay healthy relatively so that he can eat, so he can continue to live a healthy life, a relatively
Mhm.
healthy life.
Mhm. Mhm.
And I
Mhm.
didn't think too much. And then how I don't even know how many years, and then came to the US and then high
Yeah.
school, just like everybody else,
Yeah.
progressing in life, getting
Yeah.
education.
Mhm.
And then at the point that I graduated from UC Davis, and then I thought, wow, I really have to make some decisions.
Mhm.
And looking back at those few years, being by my grandpa's side, going to clinics with him, and
Mhm.
not knowing the intricacy, but I really wanted to help,
Mhm.
not knowing that there's
Mhm.
no way that I could help my grandpa, but I want to help other people's grandpa. I think
Mhm.
that was really the push for me to consider healthcare.
Got you.
And thinking, well, then what would be the most, I guess, close relationship that I can truly dosing the medications right
Mhm.
and educating people with medication? It's pharmacy. That there's no second answer.
Yes.
So, and that's how I got into pharmacy school and then started my career really at Touro. And then Dr. Ovabo mentioned that, wow, okay, after pharmacy school, what did I do? So I always interested in academia. So,
Mhm.
and then throughout the 4 years in pharmacy school, I never gave up the dream of becoming a professor. So it was just always in me. And it's really all the professors and all the teachers that I've had in my life and helping me to get to where I am today. Then I thought, well, I want to do the same thing for people, for students, so then they can search for their dreams and then move on to whatever they do and impact the people around them. And that is always, I guess, the beginning of why I still stay in academia after so many years.
Yeah.
And then yes, so after pharmacy school, then I feel like there's a gap. There's that uncertainty, or in a sense that insecurity, that, well, with this clinical degree, what can I do, or what's more can I do?
Mm.
So and at the same time I started with a fellowship already, and then I also work at Rite Aid for a few months. and it was just not, I was just not getting to a point that I felt satisfied intellectually. And then to a certain extent that I thought, okay, I need to change my approach, or I need to change my career trajectory. So, and then somehow I just, one day I logged into Facebook and I saw the ad from UC Berkeley. I thought, oh, that's an interesting program, knowing that there's no way that I can do full-time because I have a full-time job. So, and then, and that was a perfect opportunity for me to, because that was a part-time program. So, and then I just started, I applied, and luckily, now thinking back, I still don't know how I got in, but one, I got in, and then I started both. I maintained my fellowship for 2 years.
Wow.
It was a pharmacy education administration fellowship, and then I started my other more of a non-clinical training, but getting to know healthcare as a whole.
Yes.
Yeah.
I see. Oh my goodness. So you mentioned in the beginning that I know your secrets. I did your research. I didn't know any of these things that you just mentioned, because your passion for farm, now it really makes sense to me why you're so passionate, because it comes from a deeply personal level. It comes from that family history, that relationship, that closeness you had with your grandfather. And it just naturally flowed that you wanted to be in an environment where you could understand what was going on with your grandfather better. And like you said, help other people's grandparents. And I also see that thirst in you of wanting more, because only a thirsty person would have the courage to do a 2-year fellowship. And we all know how demanding these fellowships are, in combination with the Master's in Public Health program. I don't care how part-time it is, it really, it still requires a lot of work, a lot of passion, and a lot of devotion. And you telling us about this now makes so much sense to me as to why you would have the guts to jump into all of that and do it all so well. And now you stayed with Touro. We can see the bright Touro University California banner in the background there. So you are Touro now, and you're working not with the pharmacy department, right? You are in the Department of Osteopathic Medicine. So how does a pharmacist with a public health background and a fellowship in education and administration ends up teaching and working with medical students?
Yeah. Thank you for that question. So I think going back to really, I think it's a multiple factor coming together. So meeting the right people at the right time, and I think it's saying the right thing, so people will hire you, right? So I think it's first is I was at the very end of my fellowship training, and then Dr. Shubrook, so Dr. J. Shubrook just joined the medical school, and then I got to know a middle person. Actually, during one of my rotations, it was a public health rotation, I got to know that middle person, and he introduced me, Dr. Shubrook. So for students out there, for new pharmacists out there, residents out there, networking. The world is
it's your
the world is
network.
really small. You never know what will come back, bite you or help you. You never know.
Absolutely.
So, and because of that, and then somehow that we were connected, and I just start talking about my passion in diabetes and really my personal connection with the condition, and with my grandpa, who is the person that I truly cherish and love, and find out what can I do. Again, what can I do to help grandpas out there? So that was one part of it. And the other part of it is really talking to the right person, because Dr. Shubrook coming to Touro, wanting to start an interprofessional team, specifically in diabetes. And he was looking for more than just physicians. So we have PA in our team, we have clinical pharmacists, and we have dietitian. So I think that I was being the person not knowing too much what's going on. I just somehow throw myself in there and then see what will happen. And then the other thing is I was also going to school, public health. So and then with the training, with the clinical training and the public health training, I was not done. I was like halfway into the program, but I already was somehow the things that I said was able to convince him that, oh, okay, this guy might be able to help us build this team, not just from a clinical perspective, but also from the public health perspective, so that we can truly serve patients or residents in Solano County where we live. And also then now I started with assistant professor, and then now I'm associate professor, and every day is really fun. It's I would say it's work, but also work with the team that I truly really enjoy working with. So when you say, when I always hear people say, right, when you enjoy so much about your work, you're not working, you're really having fun and building something that you truly care about, and then hopefully people think the same way that you do will join you, and the team will get bigger and bigger and bigger, and that's exactly what is happening.
So it's not that you didn't want it's not that you didn't want to work with pharmacists. It's not that you love pharmacists, right?
No, I think it's just opportunity. I think it's really just opportunity came to me. And actually, so backtrack, I did work at the College of Pharmacy for 2 years, and I slowly transitioned. It's just more of because it's diabetes, and that platform is that I spend time working with the team to build that. So, and that was opportunity just came that I was asked, there is a full-time position now. Are you interested? And then I said, of course. So it's combining pharmacy or clinical pharmacy, combining public health, and then combining diabetes. And then I thought to myself, I cannot say no to this opportunity. So it has nothing to do. And academia, exactly, four things. Exactly, four things combining. So it has nothing to do with me not wanting
I know, I was just joking.
The pharmacy world.
I know. And what you say reminds me of something I heard that said opportunity has to meet you prepared. So you go to school, you do your fellowship, you're passionate about public health, you're following your heart, you're doing what you like, and then Dr. Schuberg just starts at Touro, and he's starting this interprofessional team, and you are in your public health program, you are finishing up your fellowship. It's like the stars aligned to put you in this intersection of four of your passions: the public health, the pharmacy, the diabetes, the academia, all lined up for you at that time, and you were ready. So you did your preparation, and because there's no point if opportunity presents itself and you're not ready, and you were ready when the opportunity presented itself. And that's hashtag goals, like you say. Like everyone just wants that, but you still have to put in the hard work over time, even if you're not sure where exactly it's taking you, right? As long as you're following your passions like you did.
I was ready to learn new things, put it this way, because I was still a fresh grad, just finished fellowship. What did I know? Someone just finished fellowship, and then I got hired as a professor, as a assistant professor. So that was a learning curve, to be honest. So going back to what you mentioned, yes, the opportunity is there, and I might have done the preparation right enough to support that opportunity. But then after that, I still remember going back, because this is my 9th year in working as a professor, combining the fellowship. So it's my 7th year, 8th year. So, but I still remember the first year being professor. It was learning curve. Like no one taught me, even though that I had the passion back then. I need to get into academia, but no one truly sat down and taught me, this is the thing that you need to do to be a professor. They would show me. I have so many mentors, like Dr. McCarter, my first mentor in my life in the pharmacy world. So, and then, but it's they show me, they model, this is the way how they were doing their pharmacy or their profession professor thing. But in turn, then I have to learn, I have to develop my own version. So then slowly I remember that there's days I would just like, oh, that I would just get fired. It's just like I'm just not up to speed on the things that they want me to do. And then, but it's just accumulation of things, and now and now I'm glad that things are going well, and then we're developing new things.
Wow, you're saying a lot of cool things right now, because you're talking about being ready to learn, being able to say yes, even though you're not comfortable with how because you're feeling like you're new, you don't know what you're doing, but you have people, you have mentors who are trusting in you. They know your abilities, and if they are trusting you, it's because they know you can do it. But even though you didn't feel like you could do it, you were willing to get uncomfortable because it's a learning curve. Many people shy away from taking on some responsibilities or taking on new anything because they are not sure of, they're not confident in how well they're going to do. But I think what you're saying now is it's okay to not be comfortable as long as you're willing to learn, and as long as you have great mentors along the way to to model you, so that out of those mentors you can create your own professional identity, your own professional uh, identity. Yes, how you want to live your career and your profession.
So
Absolutely.
I was not the most confident person growing up. I think one thing that I'm willing to do is I'm willing to fail, because I feel like failing is not really fail. Failing is to set you up for your success in the future.
Ah,
If you don't fail, you don't know what you're not doing well or not what you're doing
ah,
right. As long that you fail and you're willing to pick yourself up at that point, and that is the most important.
yeah.
Having the confidence will put you two steps further, but
Mhm.
not having the confidence, it could mean that you just go a little bit slower. I think that's the route that I took.
Yeah,
That
yeah,
not
yeah.
confident. Even if you don't trust me, you can ask people around me. I was not the most. I've never confident in anything, but I'm willing to try it. I think that is really the key
Mhm.
for anyone to
Yeah,
try it step by step by step.
yeah, yeah. That is, you're absolutely right. You're absolutely right. One thing that I'm very curious about is also having done a master's of public health, but mine was before pharmacy, when I was still trying to find um my career path. Having done public health, and you having done public health, and also having the same pharmacy degree that you have, do you consider pharmacists public health workers? Is pharmacy public health work? And how does a pharmacist who is interested in going into public health set themselves up for that?
Yeah. So yes, take a step back. Public health is huge. I feel like any healthcare professional, there is a place in public health. It
Mm,
just depends on what version
okay.
of public health that you want to do, and
Okay.
how can you use your training
Okay.
to combine with public health. So,
Okay.
for example,
Okay.
physicians can be public health practitioner,
Mm-hmm.
pharmacists can be public health practitioner, dietitian, nurses, anybody. But
Got
then when it comes down to the different versions of public health, it's
yeah.
different when it comes
Yeah.
down to when we
Yeah.
combine with our own training or with our own personality or
Mm-hmm.
our own belief. Because
Mm-hmm.
public health to me means that how can we develop something big enough that we can serve a certain population. But
Mm-hmm.
one thing I would like to say though,
Mm-hmm.
it's any profession, any healthcare profession that we are from,
Mm-hmm.
it's not enough to truly do the public health work. I feel like anyone from the clinical, having the clinical background, we have to get additional training. I don't mean to say that we have to get a MPH, public
Okay.
masters in public health,
Okay.
but
Okay.
we can do things in the field, like just on the job training. But if
Mm-hmm.
your heart's in public health, you will
Mm-hmm.
get that. For
Mm-hmm.
example,
Yeah.
the person that I just mentioned, Dr.
Yeah.
Jay Shubrook,
Yeah.
he
Yeah.
didn't get a master's in public health, but all the work that he was doing since he graduated from medical school, it's very public health focused.
Yeah.
And but
Gotcha.
with that, I think it's more powerful than anyone spend 2 years getting the degree. There is a value, it's very concentrated. But
Mm-hmm.
for him, his training is in the real world.
Yeah.
Getting piece by piece by piece with a long period of time is not concentrated, but still his public health training is really on the job.
On the
And also
job.
his interest
Mm-hmm.
and his heart of serving a
Mm-hmm.
bigger population rather
Yeah.
than one patient at a time.
Yeah. 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 So if I understand correctly, uh, for doctors, nurses, pharmacists, we can do our clinical work on an individual patient level, but that same training and that same passion that we have can be applied to the general population in terms of like disease prevention, and program planning and program implementation and that kind of thing at a more broader level, population level, and kind of meet metrics that way and be public health workers. And I like that you say that you don't have to have the MPH. You have to have the training, of course, the qualification to do whatever you want to do in the public, and then you have to be able to just put yourself in positions where you're doing that kind of public health work. Am I understanding correctly?
Mm-hmm. And I think the biggest difference between the clinical work and the public health work is we always need to somehow think big first, because we have to create a structure. And that is something that probably the clinical degrees doesn't have that's the training or very structured training to train us to think that way. I think that would be the public health program that train me at least, that train me to think that way. Because to when it comes down to the rework that we have to do as a public health practitioner, what do we do? Well, first we develop a program, so program development, program implementation, and also program evaluation, right? Then you get the data, and then the circle begins and then ends, right? The circle just that. So that means that is really additional training that we say anyone who is interested in public health would need to somehow get. It could be from classes, or it could be really from the job, and anyone's willing to give you the opportunity and just learn. But don't forget, the science of public health is epidemiology and biostatistics, which many students avoid that like a plague. But at that, I would highly recommend you, this is what you need to know, even though that you don't want to get into public health, but as a clinician, we need to know that, because we need to know how to interpret data from the clinical trials out there, so that we can apply that into our clinical care.
Absolutely.
So I cannot stress enough that this is the important thing. I know I'm biased because, in a sense, I teach medical students biostatistics and epidemiology, and I cannot stress enough the importance of this topic. It's really it's a lifelong skill. I always share with them. It's a lifelong skills. As long as you are in the position of delivering care to patients, this is what we need to know, and we need to find.
I agree. I agree with you. I agree with you 100%. As a student, I used to hate journal clubs because it wasn't just about reading the article. What's the point of reading the article, this new research and this new data, if you're not able to understand what it means and how it applies, whether or not it applies to your clinical practice? We use statistics and, all those terms that we avoided in pharmacy school: odds ratio, hazard ratio, statistical significance. We avoided all of that. But now when a provider on a clinical level calls and asks me a question about a new drug that just got this approval for this new indication, do I recommend it? I have to go back and read the article and see if it applies to the patient population that I'm working with, that a provider is asking about, and if it's regarding a specific patient, or all these odd ratios, all these numbers and what they mean really have to be interpreted in order to give the provider the best recommendation that you can. So even on a clinical level, epidemiology and statistics, absolutely very important. I agree. I need to come take some classes from you.
That is evidence-based practice, right? Evidence-based practice, evidence-based medicine, which combines with what you just said, combines with the patient-centered care.
Yeah, that's the fancy word, evidence-based. You've given us so much advice already, because my last question for you was going to be, what advice would you give a student out there interested in getting into pharmacy? Because pharmacy has gotten a little bit of bad rep with lower enrollments in pharmacy schools, some companies not treating the employees, their pharmacists right, and many people are not so fond of getting into pharmacy anymore, what advice would you give them about the value that pharmacists can bring and the value that they in turn can bring to pharmacy?
Yeah. So that's a great question. So I think the first thing that really came to my mind is healthcare system is huge. So there's always a place for us. But I think that we need to prepare ourselves well so that we can contribute to effective patient care, safe and effective patient care. And my opinion is, in order to be an effective pharmacist, we need to look beyond the pharmacy world to bring
Amen.
things
Amen.
what is doing the other in other professions they're doing so well, bring
Mhm.
that into our pharmacy profession so that we can continue to grow our
Mhm.
profession.
Mhm.
And then also I'm sure that other professions they're learning from us. So that is the magic that I'm so glad that I'm living it every day, that
Mhm.
because my colleagues, most of them, they are not PharmDs. What
Yeah.
does that mean? It means they're trained in a different way. They are thinking a different way than I do.
Mhm.
Sometimes we'll argue, but argue is not a bad thing. Argue, it just means exchange of information.
Mhm.
That at the end, what is the best for the things that we're doing, or what is the best for the patients that we are serving? That's the most important.
Yeah.
And
Yeah.
within a confined space in any profession, it's just the space is this small. So I think that when we bring in the ideas from other professions, it will get this big. We are increasing the size of the pie, where we then have more skills and opportunities to serve the patient that we can serve. So I think that's number one. And number two, I mentioned that earlier, don't be afraid to fail. I think
Mm.
failure, it's a part of life. It's not, I don't think it's a bad thing. It might hurt, right? It hurts
It
at
hurts.
the moment that, oh,
Mm.
dang it, I just didn't do this well enough. It
Mhm.
hurts, the emotional response. We all have that.
Mhm.
But also think that, okay, what happened, right? We cannot turn back time.
Yeah.
But then use that opportunity for students and residents. Use that opportunity to help you to grow, to be a stronger practitioner, to be a stronger clinician, so that whatever that you do, that will help you. For
Mhm.
me, I'm sitting here talking to you. Don't think that I've never failed. I fail a
Mhm.
lot.
Mhm.
But I think, again, failing would only help us to be the stronger person, if you want to take from
Yes.
the personal side,
Yes.
and
Yes.
also the stronger healthcare professional that you can be and you will be for your future patients.
Yes. Yes.
And I think the last thing that I would like to share is, um be a productive member of the team. Always the team comes first, because there's only so much that one person can do.
Mhm.
I don't care who you are.
Yeah.
There's only so much that one person can help.
Yeah.
So that means we all need to rely on other people to
Yeah.
do the bigger things.
Yeah.
That's where the interprofessional team comes in. That's what the team comes in. And
Mhm.
also believe in your teammate, and
Yeah.
also
Okay.
and also communicate with teammates. And that's where the empathy comes in. There's a lot of things that I wish I had in pharmacy school, the training, but a lot of that now I realize there's no way that we can get every topic trained when we're in school.
Mhm.
And one part of that is empathy. We can start to learn about empathy when our students, but to truly know what it means and how to apply it, you really have to go out to serve patients, and you truly know what it means,
Yeah.
and how to connect with them.
Yeah. Yeah.
You can do all the modeling you want and reading you want. That is the basis. There's a value to it.
Mhm.
However, the most important thing is go out there and practice your empathy.
Yeah.
Once that this is so important, because that's how you connect with your patient. That's how you can get the trust from your patient. And then you work together with the patient as a team. Going back to the theme that I've been talking about.
Yeah.
So that the team approach is so important.
Yeah. Yes. Oh my God, I don't even know where to start. You said so many amazing things. The first thing, and that's my favorite, and that's why I like doing the What Pharmacists Do videos, is that it's bigger than pharmacists. It's bigger than you. You're working with all different kinds of healthcare members, providers, and there's so much you can do. It's not just about working in retail or inpatient hospital. It's about, you can work in public health, You can work in academia. You can work there's a gazillion specialties that you can choose. It is bigger than just pharmacy, and you can really tailor your passion any way you want with a degree in pharmacy. The second thing is, don't be afraid to fail. And I would back you up on that 1,000 times, because failure, there's been so many quotes on failure. Failure is redirection. Failure is maybe a sign that you're not compatible with that particular thing. Failure doesn't mean don't do it. It doesn't mean stop. It doesn't mean back up. It just means just get back up and think and redirect, reassess, and see what you need to do better and how you need to improve. So I absolutely agree with that. And the third thing, which is so common sense, but common sense is sometimes not so common, is to be a productive part of the team. Whether you're a student working in groups, whether you're an intern working at a retail pharmacy, whether you're a resident or a fellow, you have to do your part. You have to do the work. And it doesn't matter, in my opinion, if they say by 2030 the job market would have declined by so many %. But I really personally think that as long as you do the work, as long as you stand out, as long as you do what you need to do and more, and you mention connections, I don't see why anyone would not have a job, regardless of what the job market is looking like, right? If you are, as long as you're productive and really working hard and really standing out and really making connections, you will find a job where your passion is. And then empathy, I mean, there's no going past that, because if you want to work in healthcare, you want to make people's lives better, you have to be able to relate with them. You have to be able to understand them and see where they're coming from. And that also means that you prepare yourself, volunteering in whatever passions you, whatever you're passionate about, whatever interests you, where you're interacting with people, and just, like you said, practice putting yourself in other people's shoes and really treating your patients, not the numbers, not what the news say, not whatever. So it's right on. And it's just amazing. It makes me want to honestly, it makes me emotional, because what you're saying right now is really exactly how I feel. It's what motivates me to want to do more every day, to learn, to grow. And I really hope everyone out there takes this, finds this advice helpful. And if you have any questions about pharmacy school and pharmacy career paths, I'm sure Dr. Young would be happy to answer your questions. Just reach out to me. I'll help you connect with him. Thank you so much, Dr. Young, for coming on
Yeah, no
and sharing
problem.
your
No
wisdom
problem.
with
Thank you.
us. And
Thank you so much.
thank you. And until the next episode, God bless you and protect you. Thank you. Bye-bye.
Bye.